Hi guys, I'm sorry that I haven't made any videos this week. I've been down because I pulled the vacuum out and because the dog got sick and had to clean it up. But some of the things I wanted to touch on today to let you know, I've been through four therapy sessions now, and I'll try and touch on that if we got time. But I want to talk how people put you down when you have chronic back injuries, and they think that it's a joke when, you're feeling bad enough. You need people to lift you up, not put you down. My sister is the worst one. She thinks because she had a decompression that she is with people that have fusion. She's not. Decompression is where they cut a little bit of the jelly out of the donut, is what the doctor explained it to me as. Whereas with a fusion, they're taking that whole jelly donut out and placing bone in between there and actually using chisels and screwdrivers and everything else on your back to make sure everything's in. And they even use a little teeny hammer to get the stuff in where they need it. Whereas a decompression, they don't do that. It's a snip of the thing, and then I think they sew it. You can go on and watch the video. There's two different things. But she thinks it's funny because she had the decompression. She can bend, she can walk, she can work. Whereas with the fusion, I have chronic pain. I can't do that. This is just one example of how you're put down. And women and men alike, your adult life is taken away. You have to physically try and get over the mental aspect of the pain in order to do anything. And you want to do it mentally, but physically when you go to do it, it's like, forget it. It's like sitting in a chair. You're comfortable and you can sit there for a little bit longer. Whereas if you stand after sitting in that chair, it's like, oh my goodness, I can't move type deal. So that's just one aspect of it. I've had people go as far as it's all in your head. There's actually a thing on Pinterest as 20 things not to say to a person in chronic pain. And that's very true. You shouldn't say that thing that it's all in your head. It is no way, shape, or form all in your head. It's physical. And there's actually studies done on pain now. And I actually have a paper of a book that I found interesting that my therapist gave to me the other day. And you can go get it. It's like, I think it's called Why Do I Hurt? A Patient's Book About Neuroscience of Pain. It actually says you can learn more on ispinstitute.com. There's it. Hopefully you can see everything. Sorry about the scenery in the background. I thought it would be nice to sit outside and film. It's by, I hope I'm saying this right. Adriaan Louw. Louw. And they did some testing, and it actually shows that the pain actually does stuff in your brain, and it causes more issues just with it being in your brain. That's one thing that I found very interesting to read and watch how to do that. So that's one book. But I've noticed that it's been very helpful for me to have this book, and I actually bought it years ago to help me with some stuff when I was stressed out. It said, "You can be happy no matter what. The 5 Principles for Keeping Life in Perspective." It's by Richard Carlson, PhD. And there's a shot of the book. And it basically talks about telling you how to live right there in the present so that you can just try to be happy in that moment. And instead of like, oh no, I got to get up and here's the pain again. So that's one tool that I do use to kind of help me with the pain a little bit. Plus, you know, therapy is a good thing to try and learn different things because not every doctor does everything the same. My therapist and a friend of mine's therapist does totally different things with us. Like, my therapist rubs my back. The last time I was in therapy, it was all Pilates, and her therapist is doing all stretching on her. But on this one, she's physically, you know, moving my muscles to loosen my muscles up and getting me to move certain ways to do it. A couple of things I have to do that, you know, or while I'm laying in bed is literally just put a pillow between my legs, tighten up my core muscles, and squeeze my knees together. The other one is, you know, when I'm stuck in bed, to lay on my side, and just the lower half from the knee down to the foot is putting the leg in and out. Make sure you get doctor's approval or their physical therapy's approval before you do any of these, because of course in no way, shape, or form am I telling you how to do the therapy on you. I'm just saying what is done for me, is kick my legs in and out. Now I'm up to in physical therapy, I use the bars, you know, like the dancing bars, but only they have them like in the gyms for the double parallel bars, I think is what they're called. But you hold on to them and then you actually like lift your leg up and then put it back down, almost like you're marching into place. And then the other one is like moving my legs out to the side, but I have to stand straight up and down. But that's some of the things that they have me doing now. Literally, I refuse to pick up a vacuum anymore. Making the bed is very difficult for me. They're two of the worst things that you want to do. You know, and try and do things slow. Be nice to yourself, because Lord knows you're going to have enough people picking on you because you can't do. You know, so be nice to yourself and try and smile as much as you can and get out of that bed as much as you can. And I know even showering is a chore, especially for the ladies that have to shave your legs. Hopefully some of you are lucky enough that you can use Nair. That'll be great. But cutting your toenails, forget that. It's a chore and a half to get down there to cut your toenails. But in order to shave my legs, yes, it's a hell of a stretch in my back, but it is also painful. So I believe me, I understand, and I'm already up to 9 minutes, guys, so I don't want to keep you too long. Leave some suggestions down in the box as to what you want to talk about, want me to talk about. It'll really help us out. Because I'd rather it be like a group of us, because there is no groups out there. You have them out there for drug addicts. You know, you have them out there for overeaters. You have them out there for everything else, but not for chronic pain. Maybe it's because the studies aren't done enough. I'm not sure. But that's where I am with it. And might edit this a little bit, but not much. I wanted to touch real quick, though, on pain medication. Make sure you're dealing with your doctor with that, and because I'm having a lot of issues with mine. So deal with your doctor on that, and work together as a team, because if you don't do it all as a team, you're not going to get any better. And it's starting to get so pretty out that, other than the rain for the last 19 days that have killed us all with this issue, it's starting to get pretty out. Deal with your doctor so you can maybe take a walk, or just sit out on your front porch and watch everything. I have beautiful area up here, as you've seen when I moved the camera and everything. I certainly would like to get out here and do more with it, but leave me some comments, like I said before, down below. Subscribe so that we can get a little group going and help one another out through this difficult time. All right, guys, take care, and I will see you on the next video.